Sand and water are two minerals used to extract natural gas from the Marcellus Shale. Researchers want to know if the way they are used can affect our health. I'm Larry Souter. The School of Medicine at the University of Pennsylvania in Philadelphia is one of 20 environmental centers around the country funded by the National Institute of Environmental Health Sciences. 16 of the 20, including Penn, are working together to design studies on the potential health effects of hydraulic fracturing. A specialist in occupational and environmental medicine at Penn, Dr. Marilyn Howarth, says open questions about the impact of fracking on health are found throughout the process.
Starting with the beginning of the process is really the mining of the sand. And although we don't do a lot of that in Pennsylvania, other states, there's a fair amount in the Midwest where there's they mine the sand that's actually used in the fracking process. And there's a lot of concern about whether people who are engaged in the mining process are adequately protected.
There is research about the health impact of the sand at the drilling site.
It seems that once the sand arrives on site, there is some good data to suggest that the workers who are putting the sand into the fracking liquids are overexposed, and the National Institute of Occupational Safety and Health has documented this and published this research in the scientific literature. So we know that there is an actual problem with exposure to sand.
But there's still an open question about the use of sand in fracking that Dr. Howarth says still needs study.
In terms of how people may be exposed who are not workers, in other words, people who live around the process, people who participate in the transport of the sand, people who live along areas where there is a transfer of the sand, perhaps from a train to another vehicle. These sites have not been adequately scientifically explored in terms of any potential exposure to people.
If the sand used in fracking is a health risk for workers and a potential health risk for people nearby, should we be concerned about the sand we all enjoy when we go to the beach?
Well, it's a great question, actually, because there's not so much of a difference in the sand itself, but there's a difference in how the sand is being manipulated, if you will, or used in the process. So if you have sand that's lying on the beach, and you really only disturb it to the extent that you're walking around in it a little bit, you're not kicking up enough sand, you're not constantly moving the sand or creating clouds of sand that you might breathe. And so therefore the nature of your exposure is much different than someone who's perhaps standing immediately adjacent to a truck where the sand is being spilled out almost on a continuous basis in the process of hydraulic fracturing where so much sand is being used. So that person has the opportunity to inhale much more sand. And in fact, it's the smallest components of the sand, not the largest sand crystals that we can see, but the smaller ones really that are able to be inhaled into the lungs and actually then lead to silicosis is the name of the disease.
Water used in fracking is another issue Dr. Howarth believes needs study.
Water is used in great quantities for hydraulic fracturing, and so the impact on an area of the use of water that would otherwise be used for irrigation of crops, it would be used for drinking water. The tremendous diversion of that water for the process of hydraulic fracturing really is an area that is not well explored and understood.
Dr. Howarth says the issue of water contamination needs to be examined in several different phases.
As water is used in the hydraulic fracturing process, it is forcibly, sort of under pressure, put into the ground. And when it's there, it doesn't go in as pure water. It has a variety of constituents that are put in on purpose because these constituents, these chemicals, have uses that are important. And they're very different site to site because some of them are based on the kind of rock that's there. So if the drilling is going very easily, there may be different constituents than if the drilling is through a rock that is very hard to get through. There may be some metalworking fluids that are would be more fully utilized or more in a higher concentration in the latter case.
Different drilling companies may use a different mix of chemicals at different sites, and that information is not public.
sometimes individual chemicals are more toxic when several in the same class or several in different classes are added together. Sometimes they're less toxic, but that is an open question that really should be explored.
Dr. Howarth hopes their research can be used by the Pennsylvania Department of Environmental Protection and other regulators to write regulations based on science. For WPEL, I'm Larry Sauter.